Kerala Institute of Health Sciences, Nepal. Dr. Ishita Sachdev, diabetologist, Mumbai, and content creator.
So actually, this session should be before lunch. No more spikes, mastering meal for the maximum time in the range. Okay, it's okay. We'll manage in the dinner, in the gala dinner. So for this, we have Miss Sheryl Salis from Mumbai. I think she need no more introduction. She is well-known dietitian from the Mumbai, registered dietitian, and author of the very good and my favorite book, Diet and Dietitian. And over to you, ma'am.
Yeah.
Thank you.
Thank you so much. It's an honor and pleasure to be here and look forward to JPEF every year. So thank you so much to the JPEF team, Dr. Jyoti Dev, Sunita ma'am, Gopika, Anjana, Geetu, and everybody. It's always wonderful to be here, and what a lovely thing to have Dr. Ishita and Dr. Ajay to be chairpersons for my session. I'm going to be speaking on no more spikes. I think I have 20 minutes for my talk. Yeah. It's a 30-minute session. Yeah. Sorry, I want to be careful. Okay, so no more spikes, mastering meals for post-meal glucose. How many of you all think that managing post-meal sugars is a challenge? Can we have a raise of hands? Yeah? And in India more so, especially now in the post-lunch session, I'm sure, we are already having our glucose spikes going up. And let's look at strategies on how do we actually help blunt these spikes. Now, if you look at India, we as a country are very different to all the other countries in the sense we have enough surveys and studies, and I don't think we even need it. We know that we are a carb-loving country. We eat a lot of carbs. And again, studies and surveys have shown that the quality of carbs is definitely a challenge. We eat more, polished carbs versus unpolished, and especially in today's times, definitely the intake of polished grains is going up. The intake of protective foods such as dairy, fruits, etc. is going down. And there's consumption of PUFA-rich oil and saturated fat. Again, the CURE study done by Dr. Mohan and team have shown that, yes, it does increase. The consumption of these foods have gone up, and therefore also we're facing a diabetes and obesity tsunami in our country. Again, intake of refined grains, especially polished rice, more than 75% is associated with increase in insulin resistance, high waist circumference, weight, etc. Now, you all will agree with me that, in the recent times, especially post-COVID, etc., today there's a lot of access to food, whether, you can just order food on your, on different apps. Activity levels have really reduced. There's inactivity, there's high stress levels, lack of sleep. Again, screen time has gone up, and all this has only gone and accelerated the problem. And postprandial hyperglycemia continues to be a challenge, and the 4-hour period that follows ingestion of a meal with a peak near 2 hours is always a big challenge, especially in our country. And therefore, if you see in India, whether it is, whatever HbA1c levels, the postprandial blood glucose levels are contributing to the post-meal spike. So that, are contributing to the HbA1c. And this is something that we need to be mindful about. Now, increased calories. Now, this is the What India Eats report. And what they've shown is that most of the calorie consumption for us Indians comes from cereals and millets. And it is much more than what is recommended. In fact, the NI and ICMR guidelines recommend around 45% of calories coming and less coming from cereals and millets, whereas right now we're eating more than 60% of calories coming from cereals and millets. So it's very high, and your pulses, etc., should contribute around 15% of calories. Now, definitely, this is a challenge. Another thing that most people with diabetes think that you have to eat every 2 hours to control your, if you have diabetes. So what they start is, they start a heavy breakfast. So it will be poha, idli, upma, puttu, idiyappam, whatever is the breakfast across the country. And then mid-morning again, they're in office and there'll be a packet of biscuits or something. And then there's lunch. Evening snack is the biggest challenge that we see, and most of the unhealthy eating happens over there, whether it is biscuits or some kind of packaged foods most of the time, and then there's a heavy dinner. And today we are binging on Netflix late in the night, so again, there's a dinner after dinner. We're often very hungry, and most people we see, when the nighttime sugars are high, fasting sugars are high, and then they say, we were hungry in the night, and then they've gone and had some dessert or whatever is available in their cupboards. And therefore, our people are most of the time in the postprandial state. So we really do not achieve that time in range, and there's high glycemic variability that we see. Now, these are the challenges faced by people with T2DM, that only 4%, this is in our country, so only 4% of the 2,269 patients in the multi-center DietCare Asia-India trial adhere to specific dietary regimen. And you all will agree with me that when people are diagnosed, they're very careful. They'll be very scared because they don't want to get onto insulin, or they don't want their medications to increase, or some of them want to manage without medication. But then as the time goes, the compliance does come down, and adherence is the biggest challenge that we see. And what they saw is that the postprandial blood glucose of 62.5% of PWDs, that's people living with diabetes, was above the target range of 180 milligram per DL. And more so because they are frequently eating, and because they think that we need to eat more, and what they eat is actually carb-rich foods or carb-rich snacks, which constantly keeps them in the high postprandial glucose range. And despite the availability, we have so many conferences, so many newer drugs, we have a multi-speciality team. However, the real-world data indicates that up to 60% of patients with T2DM exhibit suboptimal glycemic control, and therefore achievement and maintenance, more than that is maintenance. You may achieve an HbA1c of less than 7, but actually maintaining it is always the challenge. There's so much of cultural and culinary diversity. In our country, we eat so differently, north, south, west, east, central India. But what they've seen in the START studies, no matter which part of the country you come from, the carb intake is definitely high, the amount of processed and polished carbs is high. Saturated fat consumption is also going up, because of more and more packaged foods that we're eating. And if you look at most of the biscuit packets or any of the packaged foods, they're usually using palm oil, which is again saturated fat. And then there are a lot of fads which are propagating only use of ghee in food or only use of coconut oil, and people are actually switching from other oils to these oils, thinking that they are more healthier. And therefore, we definitely need effective strategies to reduce the burden of the disease. Now, this is what I would like to show you, because we're having the Libre 2 launch today, but I would also tell you that today, initially it was very difficult for us because people used to actually do their finger pricks, not very regular with monitoring. But today with CGM data that we have access to, there's a lot of insight that we also get as dietitians or as clinicians. So one is rice flakes, and it's called Aval here. And I know everybody with diabetes thinks that rice flakes is God's gift to diabetes. In fact, a lot of people with diabetes will eat a lot of poha. We call it poha, or anything made out of rice flakes. And what we typically see on a CGM, that it spikes the blood glucose rapidly. Do you see the same thing when you do CGM studies, or when you do the CGM for your patients, or even monitoring? The post-meal glucose after eating poha is usually on the higher side. Again, a paratha. In fact, a paratha has got a lot of fat in it. And it's also made from, they use more amount of wheat flour. And therefore, you will see that the blood glucose does spike, and the spike lasts for a longer time because the fat delays the gastric emptying. And then we have a Pesaretto dosa, which is a pulse-based dosa. And if you see that with that, we really do not see such a sharp spike in blood glucose. In fact, the blood glucose levels are very stable. And even an egg at breakfast, we see a very, very good blood glucose response. So typically, we tell people that do eat an egg at breakfast if you are an ovo-vegetarian, or or if you're a non-vegetarian. It does help to improve the post-meal blood glucose spike. And therefore, all carbs are not the same, because that is what our patients will come and tell us, that yesterday my post-breakfast was good, but today my post-breakfast is very high, and every day it is varying. One is there is individual variability, that each person will show a different response. And of course, depending on the kind of foods we eat, we will definitely see a spike in blood glucose level or a blunt in the glucose level, depending on what we've eaten. And therefore comes the concept of glycemic index and glycemic load. Now, glycemic index is the speedometer of the food to raise the blood glucose levels. So every food has got a certain rate at which it increases the blood glucose levels. For example, your polished grains will increase the blood glucose levels more rapidly than your unpolished grains. When you look at, when it is coming to, your grains, a long grain rice will actually have a lower glycemic index compared to a short grain rice. So again, it is very different. Coarser the grain, the lower the glycemic index. Finer the grain, the higher the glycemic index. And then comes glycemic load, which takes into account the complete carbohydrate content of the food. Now, there are various strategies that we can employ, and that is what we dietitians would do when a person with diabetes is referred to us, is one, we look at food combination. Now, we said that yes, rice flakes does increase the glucose, but does that mean a person with diabetes does not eat rice flakes for the rest of his life? No. We would try and use strategies to blunt the blood glucose response after eating rice flakes. So what we would do is add some sprouts to it, add some vegetables to it, we can add peanuts to it and squeeze lime. So the moment you do that, one is you're adding fiber, you're adding protein, and you're adding an acidic medium which actually blunts the glycemic index. So food combination. So whenever we eat, I don't think we eat just rice in silo. We would eat rice with a curry, with vegetable, with some curd, and therefore it becomes a balanced meal, and it also helps to bring down the glycemic load as well as the glycemic index of the meal. Now, this is an interesting study that was done by Dr. Alpana Shukla, and she's doing a lot of studies, whether it's in people with pre-diabetes or people with diabetes, and food order. Now, this is a very simple strategy that we can tell our patients. You start your meal with salad or a fiber with protein, and then follow up with the remaining meal. By just doing this, you can actually blunt the post-meal glycemic response. For example, if you're in a buffet, there is salad, there is protein, there was eggs or whatever protein source is there, and then your remaining food, eat that in that order, it will help to blunt the post-meal glycemic response. Then comes cooking technique. One is when you cook for a longer period of time and you cook with more water, the glycemic index goes up. And therefore, when you're cooking rice, instead of using the ratio 1:3, if you use the ratio 1:2, and cook it till it's just al dente, that means the grain should be, there, it should not become like a mash. That will actually keep the glycemic index of that rice lower. Then the fruit, I know we are in Kerala, we love bananas. So telling a person with diabetes don't eat banana is not possible, but very important is how much to eat. And the riper the fruit, the higher will be the glycemic index. So we would always tell them to buy slightly unripe fruits and a fruit which fits your fist size. Again, adding condiments such as lemon, cinnamon, vinegar, ginger and fenugreek to meals does help to blunt the glycemic response. Now we come to rice. Now again, we are South Indians. Imagine telling a person in South India, don't eat rice at all. It's not possible. I've done it in the past, but today I wouldn't do it because I know it's very, very difficult and we all love food. And therefore, we want to retain the joy of eating in people's life. So one is that brown rice, red rice does have a lower glycemic index compared to your Japanese rice, the short grain rice, or even the Sona Masuri, the Poni and the Surti Kolam, they have a higher glycemic index. So we would tell them to use different rice varieties which is more unpolished, and like I said, the cooking time as well as the water that is added to the food, and squeeze lime or add, like we have tamarind rice or lemon rice, or we can have it with protein and fiber. Automatically the blunting of the post-meal glycemic response will be seen. So we could do this. This is the food order. Start the meal with salad if there's curd or curry, and then follow it up. And this is what our patients actually do. We've given them those measuring cups. So they know exactly how much we mean when we say 1 cup of rice. So that is typically around 30 grams of carbs. So when they get that portion control, then they are able to understand how much should I eat. So it's not what you eat, but it's also how much we eat. Then comes your rotis. And we have enough evidence to show today that yes, we can blunt the glycemic response after eating a roti by simple techniques. And this is a study again done by Dr. V. Mohan's group, where they added actually roasted Bengal gram flour powder, isabgol and debittered methi powder, and the ratio 4:4:1. And they did see that the glycemic index of that roti actually went down to 27.3 from a 45.1. Also adding chana dal and barley, and again barley is an ancient Indian grain which is economical. When we are always prescribing to our patients, we have to also look at the economics. Nothing should be too expensive because they have to adopt this as a lifestyle, as a family. So very important is this simple change. So just having, instead of wheat, you add wheat with chana dal, the glycemic index comes down, and then wheat, chana dal and barley, again if you look, the glycemic index is around 39. Now this is one of our own patients, South Indian woman with diabetes. And if you look, breakfast, she has a ragi idli. And then evening snack, she has ragi porridge because she thinks that ragi is very good for diabetes. How many of you think that ragi is good for diabetes? Can I have a show of hands? Yeah? Okay. So I'm sure you all will be in for some surprise. And you look at the amount, the blood glucose spike. And she actually messaged me that I have had ragi idli. Why has my blood glucose spiked so much. Now let me tell you, one is that the ragi that is available in the market is more polished. Also the glycemic index is the highest compared to all the other millets. It is quite high. And therefore again, when you make an idli out of it, with fermentation, the glycemic index goes higher. So that doesn't mean you don't eat the idli, but you, instead of having 3 idlis, you have 2. Have it with sambar with lot of vegetables and with the chutney. Automatically the glycemic load and the glycemic index will come down. And when we told her that, it worked beautifully. Again, the dal to ragi ratio we can actually modify. The ragi porridge, again, because it's in a porridge form, will spike up the blood glucose rapidly, and we can give her different alternatives over there. Now millets, last year was celebrated at the International Year of the Millets, and everybody switched to millets. And this is again from Dr. Mohan's study, where they saw that all millets, especially a sorghum roti, which is your jawar roti, your pearl millet roti, which is bajra, all of them have a higher glycemic index. And it does spike up the glucose. So what do you do? One is that look for the lower GI millet. So you have barnyard millet, you have foxtail millet. Again, very economical, available on Amazon or any supermarket. Look for more unprocessed and polished. So these are better millets to use. Not that you can't use the others, but these are more preferred in terms of the glycemic index. If you look at finger millet, which is ragi, it's got a glycemic index of around 61.1. But the moment you make that ragi into a porridge, the glycemic index goes up to 90. So it goes up really high. So try a different carb which has got more fiber, and like I said, foxtail or barnyard millet. In fact, in the study that they did, they saw that broken wheat upma, which is your wheat which is broken, your white chickpeas sundal, white peas sundal has a lower glycemic index. This is an interesting study again done by Dr. Anup Mishra and team, where they actually gave a pre-meal load of almonds. So they gave 20 grams of almonds before breakfast, before lunch, and before dinner. And what they saw is that, yes, it helped to improve satiety, so people ate less. The glycemic response, if you look at the CGM of the control versus the study group had much flatter, the CGM trend was much flatter, and also the A1C was, the fasting glucose levels as well as the post-meal blood glucose levels were better in the group which was given almonds. Again, this is where our people say, we tell they eat 2 cups of upma in the morning or 2 cups of poha in the morning. And if you tell them to just have 1 cup of upma or poha, they won't be full. They'll feel hungry again in the next 2 hours, and then they will look for biscuits, etc. So if you look with 2 cups of upma, one is they get 380 calories, 58 grams of carbs, 6.5 grams of protein, and the blood glucose spike is pretty rapid. But what if I change this? I tell them, okay, cut down on 1 cup of upma, but instead of that, you start your meal with an egg. For a vegetarian, you can have a bowl of yogurt or you can have nuts. Automatically, if you see, the calories remain very similar, so it comes down by 70 calories, but the carbs have gone half, and the protein has actually gone more than double. So we've added 1 whole egg and 2 whites. And this is again something which is very practical, easy to do. And typically our patients tell us that they don't feel hungry till lunchtime because the resistance is the highest in the morning, and therefore post-breakfast glucose levels are very, very hard to manage. So gone is the days where we say eat breakfast like a king, eat lunch like a prince, and dinner like the pauper. I think in today's times you have to eat all meals like, in moderation, and that is something that we need to pass on the message. Again, lentil carbs, again I'm going to puttu. Now we have puttu and kadla, we love it. I love it when I come here. But instead of having so much of, puttu, which is going to shoot up the blood glucose levels, I can actually do lesser amount of the puttu, more of the kadla, and therefore I'm getting the lentil carbs, I'm getting the satiety, as well as my blood glucose levels post-eating is also managed. So it's basically about moderation of the carbs, giving better carbs in the form of lentil carbs. Now we come to the PRIDE study. Now this is this interesting study which was done to actually look at partial meal replacement to see whether the impact of partial meal replacement helps in postprandial blood glucose levels. So what they did is it's a 12-week study, and they put half the group on DSNS, which is a diabetes supplement, nutritional supplement, either at breakfast or as an evening snack replacement to be taken or it can be taken as a PMR before a major meal like lunch or dinner. So 1 serving of 50 grams of DSNS was given. And the other group, which is the standard of care group, received their normal diet along with counseling. And if you look at the amount of, the 50 grams provides you 227 calories, 10.1 grams of protein, and 23.1 grams of carbohydrates. So it does have lower carbs, but more protein. And therefore, the concern that we have deficiency of protein and we are eating more carbs can be addressed by this strategy. And therefore, they saw there was a reduction in mean HbA1c in the study group, which is the group which was having DSNS, as well as there was also reduction in body weight, which was significant in the study group. Now, I'll show you in practice how we can do it. So what we usually do is, see, when we replace all 3 meals, like it was done in the direct trial, it's very hard. We like food, we like to eat, we can't have only liquids. But what we can do is pick up one meal, which is the heaviest meal, and replace that with a meal replacement, or we can do a PMR. So we can either do breakfast and lunch replacement. So there we are moderating the carbs, but we are improving the protein, and therefore this can help. One is achieve calorie deficit, weight loss, as well as better blood glucose control. This is the biggest challenge that we see, evening snack. And that is a problem. And then they're at office, they don't know what to do. So what we do is, and this is how the blood glucose levels look like. They've had a heavy evening snack, which is carb-rich, fat-rich, pre-dinner sugars are high, and this even reflects in the early morning sugars the next day. So an effective strategy would be that evening snack when they're at work, we can look at either a diabetes-specific nutrition supplement, or we can look at biscuits. You do get biscuits today, which are very handy. You get that 1 serving of biscuits, and this is something that people love. You get them in different flavors, either jeera flavor or vanilla flavor. Again, we've seen with our patients excellent blood glucose control as well as satiety is achieved. Again, if you look at the calories, it's only 104 calories, 7.5 grams of protein, and 10 grams of carbs. So it is what a snack should be. Today, typically snacks are becoming heavier than dinners. And this is what really fits in for a busy professional or somebody who's traveling. We have people who do travel jobs, or even for us, in between patients, this becomes a very handy snack for us to eat. A second meal effect is also something that we can, look at. When a person, I showed you the upma example. So when you actually lower the glycemic index and the glycemic load of one meal, it not only helps to improve the glycemic index and the post-meal blood glucose levels of breakfast, but also of lunch. So it has the effect on the second meal as well, which is fantastic. And therefore, actually lowering the glycemic index and glycemic load with all the strategies that we showed you will help to keep the blood glucose levels in range throughout the day. And therefore, there is a power of nutrition, and therefore working with a qualified nutritionist is something that I would encourage all of you to do, because that will really help you achieve, one is adherence, bring back the joy of eating and living in people's life, and work as a team to help achieve your time and range. My last slide. Another thing is exercise prescription. Today we tell people that, you can't do too much of, you can't remove time for maybe 30 minutes, 1 hour walk. Can you do 10 minutes post meals? Now this is something that is a very effective strategy, because even if you look at, old Ayurveda, it does talk about Shatapavali, which is 100 steps. So after meals you walk 100 steps. So that is something that we can tell people to do. Instead of sitting for long hours, every half an hour get up from your seat and start, walking, or just take a break and walk. That itself is good to break the sitting cycle. As well as there are studies to show that when you're sitting and you just fidget your legs, just up and down your calf muscles, that itself helps to improve the postprandial blood glucose levels. And this is something that we also can do when we are seeing our patients. So yes, activity does help to improve the glycemic control. Now this is something that I have recently started. It's called Food Facts Decoded. If you have your cameras, you can take a picture of that barcode, and you can go and watch these videos. So we are actually putting videos on different topics. We've got decoding food labels, we've got on gut health, etc. So you can go and watch it. We'll be doing this every week. So every week there'll be a new video which will be put on. So you can go and subscribe to the YouTube channel. So thank you so much for your patient hearing. I'll be happy to take any questions.
Do we have any questions from the audience? I have one for you, Sheryl. It's a lovely talk, and it's so important to stop falling prey to all the myths and the misconceptions. So there are a lot of people who advocate just put on a CGM, even for people who are non-diabetic.
Yeah, I think nowadays, one is that yes, for people with pre-diabetes, you put it, at least they get a little conscious. I think that's a good thing. But I know what you're referring to is like today you have people on social media who are constantly trying to test foods and showing you different foods. But I think that is not something that is what we would, in fact, now it does irritate me also because it's just too much. And that those people do not even have diabetes and they'll keep testing different foods and showing you. And again, every individual will respond differently, and that I think we're somewhere trying to create a fear psychosis about food. And therefore, working with each individual and seeing how their body responds is something that I would look at. Because like I told you, rice flakes does increase glucose in most people. But there are some people that I've come across where it does not increase the blood glucose. In fact, it works very well. So therefore, there is something like a personalized nutrition and personalized medicine. That is what we have to look at. And that is how we would work.
It was a wonderful talk. I'm
Thank you,
Dr.
sir.
Krishna Kumar, Professor of Medicine from Cochin, Kerala. A few comments. One is about emotional eating. There are people who eat to get out of stress, get out of depression. And they eat and they feel a little better. To enjoy that, they eat more. So that is a cycle
Yes,
which
sir.
has to be broken. The second comment is on the advice by the doctors. All of us may not always get the help of a nutritionist. So the advice has to be precise. For example, a diabetic was told that you can have 1 fruit per day by the physician, not by the dietitian. And the patient had 1 jackfruit full.
Yeah, that's why I spoke about portions.
So the advice has to be quite precise.
Right.
Similarly, another patient was advised, do some exercise. That was the advice given by the physician. And of all the exercises in the world, he started doing horse riding. After 1 month, the horse lost weight. So again, the precision of the advice has to be
So
very,
I
very important.
Totally agree. I think very well said. And this is something, that's why we said about fruit, because they say papaya and they go and buy a big papaya and that papaya is going to get spoiled, so they eat the entire thing. And then they wonder why is the sugars level going up. So portion control, especially fruits, because they think they can eat fruits ad libitum.
One more comment, please. Remove all screens when you're eating.
Absolutely. So.
All screens.
And before
no TV
sleeping.
in the dining room.
Yeah.
No mobile with you when you're eating. And that's part of mindful eating.
So in fact, we say, we have the 3-2-1 principle. It says that 3 hours before, stop thinking about anything stressful.
After all, there is no good food and bad food. There is only good diet and bad
Right.
diet.
True.
Thank you.
True, sir. Very well said. Thank you. Can you go on?
Yeah, you were mentioning about the poha, right? I think the one which you get in North India is the white one, polished one.
Yeah.
Here we get the
Yeah, in fact, I was going to come to that. In fact, there are a lot of varieties. In fact, even savia, which is the rice, it's very popular. It's called savia or the rice vermicelli. In fact, nowadays you are getting low GI vermicelli as well, and it works beautifully because a lot of our patients are using it. It works well, and you do get the red poha, but make sure you're buying the red. In fact, when in Bombay I bought the red poha, I washed it, the red color went off. So it was not actually red poha, it was just red colored poha. But you do get even rice, like you do get the red rice, and we do tell people. In fact, today itself, one of my patients has switched to red rice, and he said, I loved it, and my glucose levels were really good. So there is a lot available, and that's what I mentioned, that what is available mostly is polished, even the millets. In fact, the studies done by Dr. V. Mohan's team have shown that most of the millets that are available in our country are polished. So when we're looking at it, look for unpolished, look for lesser processed, and that would be better. But of course, with millets, you have to soak the millets, cook them well, because they do have a lot of anti-nutritional properties as well. And therefore, soaking millets maybe overnight, and then you cook it, that actually helps to destroy all the anti-nutritional properties. Because otherwise your sugars will be good, but there will be a lot of nutrients which will not get absorbed because of these anti-nutritional properties. Yes, that. Yes, sir. That works beautifully. In fact, they did a study where they showed for 3 hours. Absolutely. That's what I said. Even us in our clinics, we can do it. So they did a beautiful study where they actually looked at 30 minutes, 60 minutes, every 30 minutes for 3 hours. And they saw that the glucose levels went down, and people started feeling better. So the limb blood flow also increased. And that is something which is, so whenever we give advice, because typically why there is no adherence is because we make them do things which are very difficult for them to do.
I think we have to stop questionnaire. Like due to time limit, we have a 3 o'clock other session. So ma'am will be available till tomorrow. So she will be happy to take question anywhere. So thank you.
Thank you, Sheryl. That was a lovely talk, and any personal questions can be taken outside. Thank you so much for your time, everyone, for your patient hearing.